Hi, congratulations about your new baby. I'm sure you guys are excited to head out of the hospital. But before you go, I want to talk about some things for discharge teaching. We're going to be covering a lot of topics, so let's just jump right in. First, we're going to talk about your diet. We want you to be adequately nourished. If you're breastfeeding, you're going to be burning a lot of extra calories, and your body really needs that nourishment, and you also need to heal post delivery. So we want you to eat a diet that's high in fiber and rich in calcium. Foods that are high in fiber are things like broccoli, cauliflower, bran, fruits, and all of these are going to help you with your bowel movements because you can experience some constipation during this time. Next, as I said, calcium, that includes milk, yogurt, and dark leafy greens, so try to make sure you have that. We also want to make sure that you're adequately hydrated, so be sure to drink water throughout the day, and you can even include some juices as well. And although we do have all these wonderful foods that you can have, we also have foods that you're going to be avoiding, kind of like the things that you avoided during pregnancy, such as soft drinks, coffee, tea, and alcoholic beverages. Next, let's talk about your exercise regimen. So we don't want you to jump in super fast and start lifting and pulling and pushing, all that sort of stuff. We want you to keep it slow and gradually move into your exercise routine, and be sure to avoid lifting, pushing, and pulling for at least the first 2 to 6 weeks. Next, let's talk about breast care. So your breasts have gone under a lot of change during your pregnancy, and even more so now that you have had your baby. You're going to be having some milk let down and leaking and stuff like that. So we need to make sure that you're caring for your breasts properly. We want to make sure that you wear a well-fitted and supportive bra day and night. That might be the most comfortable for your body as it adjusts. We also recommend wearing breast pads that you put for your breasts when they're leaking. You can just put them inside your bra and leave them there. And you may also apply ice packs between feedings for any discomfort that you may experience. Now, for breast care for patients who are not breastfeeding, we need to take into consideration that your body will be producing milk. So again, we want you to wear a well-fitted supportive bra, and we do not want your breasts to be stimulated by you, your partner, or your baby. So just try and keep your hands away, their mouths away, everything, because we don't want more milk to come in. You can also apply cold compresses in a form of a frozen towel, ice packs, or cold packs for at least 15 minutes at a time. But you want to make sure that when you do put a cold compress on, that it's not just like ice to skin. You want to have some sort of barrier between that. Next, let's talk about breastfeeding for those women who are choosing to breastfeed. We want breastfeeding, not nipple feeding. So when you're breastfeeding, you want to see a whole big chunk of your breast in that baby's mouth. You want to barely see like maybe half of your areola. If you see like that they're just on the nipple and you can see your whole areola, they are not doing that right. So if they are suckling incorrectly, you can easily take your finger and go around like this and break the suction from their mouth, and then reposition and try again. You're going to want to have the baby close to you, close to your arms, with their head turned towards the nipple and very close so they can see and smell and grab that nipple with their mouth. It is important for the health of your breast that your infant feed from both breasts during each feeding, so you're going to alternate. And again, their feedings are going to be about 10 to 30 minutes and multiple times throughout the day. It's going to be a good sign if you hear your baby swallowing, but we do not want to hear any clicking sounds. We also might see a little wiggling in the baby's ears, which are super cute. But something else that you don't want to see is dimpling in the cheeks. That is not a good sign. So again, if that happens, reposition. If you feel, you should feel tugging while you're breastfeeding, but if it's painful, something might be wrong. And you should definitely talk to a lactation consultant regarding those concerns. All right, so let's go on and talk about hygiene. So let's be honest, your body just went through a whole mess, and your hoo-ha is quite messed up right now. So in the nicest way possible, because you just gave life. So we want to take care of that. We want to make sure that you're wiping front to back, and that when you're using the restroom, you warm up a little bottle of the Perry bottle with a little bit of warm water and squirt your vulva and all that goodness to make sure that you're clean down there. And again, you're going to use that after your urination and your bowel movements. Next, in the same lines of down the nether region, we're going to be talking about bleeding. So you will be bleeding for some time, but it should not be so much. You should not be able to saturate a pad within 15 minutes. And you're going to have your blood will change in colors. It will be a bright red to pinkish to brown to yellow to nothing. So it's going to change over time, and just make sure that you're stocked up on pads and ready to go. You're also able to have a menstrual period within 6 weeks to 2 months after the birth of your baby. This is something super important to remember. That means that you can get pregnant. So we really need to talk about birth control with your healthcare provider. And we don't want you to be having any sexual activity for the first 6 weeks after discharge. We want that area to heal. So please avoid sex for 6 weeks and talk about options for birth control. That's definitely important. For your bowel movements, you might experience some constipation like I mentioned before, and with that, you can use laxatives, like mild laxatives, and you can also, like I said, change your diet. You need to increase your fiber intake, and you need to have lots of hydration, lots of fluid. So we have some things that you might want to report in terms of things might be off with your body right now. If you have pain, redness, warmth, swelling, drainage, or foul-smelling discharge from your incision site, you need to talk to your healthcare provider. If you have discharge that smells, you need to talk to your healthcare provider. If you have a headache or blurred vision or any visual changes, again, talk to your HCP. I'm just going to say talk to your HCP, okay? If you have a temperature of 10.4, or you feel cold and feverish and have those chills, call your HCP. If you have thoughts of harming yourself or your baby, if you're having crying spells or mood swings that feel out of control, talk to your healthcare provider. Call for help, because we want you and your baby to be okay. Pain or burning sensation, redness, warmth, or swelling in the legs are not good signs. We want to talk to your healthcare provider. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms indicate something's going on. And again, you need to call your healthcare provider. If you have sharp pains in your abdomen, breast, or chest, that's another cause for concern. If you have trouble breathing, dizziness, or fainting, make sure you get that checked out. And if you're having difficulty with urination and urinating, and maybe it's painful or difficult, or you're going too frequently, call your healthcare provider. And lastly, if you're having difficulty with your bowel movements, and talk to your healthcare provider. They might offer you some of the resources or recommendations that I recommended, but it can also mean that something else is going on. So moving on, let's talk about the safety of your baby. They're gonna be sleeping a lot. So when they're sleeping, you wanna have them sleeping on their back. You're gonna use nice, soft clothing. You wanna keep them warm, kind of dress them how you dress on a normal basis. But while they're sleeping, you can either have them swaddled up, or you can have them in these cool one-piece sleepers. When they're in their crib, you want to make sure that you have as little as possible in there. We do not want anything to get in their way that could cause them to suffocate. So keep blankets, toys, wedges, pillows, all that good stuff out of the crib and away from your baby. Also, your baby should be sleeping in the room with you, but you know what? Co-sleeping is not recommended. So keep that baby out of your bed. We don't want you rolling on top of them or throwing something on top of them that can eventually lead in death. So be sure not to do that. You're also going to want to have a bulb syringe. Now, we provide one at the hospital, and it works well. That's going to be to clear out anything if they're having difficulty breathing, if they sound a little snotty and stuffy. So make sure you keep that up. And when you wash that, just warm it with some nice, warm, soapy water with each use and allow it to air dry before the next use. We also, I have to tell you, you need to make sure that your car seat is up to date. And if you do not have a car seat, we have a car seat to provide as well. Now, when you do go home with your new baby, I know you want to shout it to the world, but let me tell you, do not put a beautiful stork in your yard, because that can alert to others, maybe baby predators. Hey, I have a new baby here, come take him. So we want to make sure that you kind of keep that great announcement a little private, at least in your neighborhood, and share only with people who you are familiar with. If you notice anyone unfamiliar around your home, you need to call for help. Yes. We also recommend that you do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Behaviors of the babies, they should be crying. So if they're crying, not that they should be crying, but they are going to be crying often. And when they do, you need to assess what they need. Are they hungry? Do they need a diaper changed? Do they need to be burped? Burping is very important. We're going to be talking about feeding later, but something to know is that you should burp your baby after every feed. And if you're feeding with formula, you should burp every one half ounce. I think it was a half ounce. But when you burp, you're going to put them up and pat them on the back like this, gently and softly. You're also going to have to use some calming techniques. Again, you're going to be changing the diaper, rubbing the back or tummy, walking with the infant, holding them, lots of things. Skin-to-skin contact is wonderful. You have the option to give them a pacifier, have them suck on your pinky, but always remember to be kind and compassionate to your baby, because they are new little loved ones in this world. So if they get on your nerves and you feel frustrated, remember to kind of step out of the room and walk out. Go call a friend, cool off. We never want you to put your baby in danger. It's also important to know to never shake your baby. That is never okay. So like I said, these babies are going to be sleeping often. If your baby is sleeping through their feedings, you need to make sure that you wake them. They're going to be, they should be feeding at least every 3 to 4 hours. So you got to wake them for that. Also, you should place them on their back when they're sleeping, but it's also important for them to have tummy time each day, but supervised, because we want to make sure that they're breathing, and they're either going to lift their head up or they're going to turn it to the side. But put them on that stomach. That's going to help them strengthen their neck and abdomen. Next, so diet for the infants. We talked about breastfeeding, but we also have formula feeding. So if you're breastfeeding, you're going to be feeding about 8 to 10 times per day. And again, I talked about how you want to breastfeed. You want them to be snuggled up to you, close, and skin to skin is definitely great as well. And you're going to be burping them afterwards. For formula feeding, if your baby is sleeping through their feedings, for formula, you need to make sure that they're up every 4 to 5 hours for feeding. And with this one, your infant will generally be taking about 2 to 3 ounces per feeding after the first few days of life, and then they'll need to eat every 3 to 4 hours. So again, if they're sleeping longer than 4 to 5 hours, make sure that they wake up, but it's preferred every 3 to 4 hours that they're feeding. Also, as I said, burped every half ounce of formula for formula feeders. Now, let's talk about your baby's skin. Baby's skin, a lot of unexpected things can come up. A baby can have a rash. It is normal for your infant to develop a rash on their skin. If it appears with small red circular areas with a white dot in the middle, this is normal, and it will resolve within a few weeks. You're going to want to avoid lotions, powders, and perfumed soaps for your babies. So make sure you invest in some good baby hygiene products. Next, we're going to talk about milia, and I actually have some milia, but babies get it too. Milias are like these pearly little white bumps that you get on your face, and it's like from a collagen buildup, I believe, but those should disappear after the first week of life. Another common skin development in children and little baby infants, newborns, is jaundice. And this is the most common occurrence. So basically, jaundice is when your baby appears a little yellow in their skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours after leaving, you're definitely going to need to call your healthcare provider immediately, because there might be some actions that we need to take. So let's talk about some infant care. You're going to be bathing your baby. And remember, I said find some nice baby branded hygiene products. But also they have an umbilical cord, so don't forget that. You're going to be assessing that and making sure that it's clean and dry. You're going to cleanse that with warm water and soap when it's soiled, and be sure that you inspect it for any sort of changes, drainage, or discoloration. If that happens, you call your healthcare provider. But the umbilical cord should fall off within the first 2 weeks of life. Again, with the bath, you're going to be using baby hygiene soap, and they're going to be having sponge baths. Make sure that you get them nice and warm after, because we don't want them to be too cold, but just be very gentle, especially with their face. Next, let's talk about their wet diapers. So we talked about how much they're going to be drinking and eating, or breastfeeding, or formula feeding. And with this, for the first 1 to 2 days, they should have at least 1 to 2 wet diapers. But after that, you should have at least 6 to 8 wet diapers of pale urine every day. Now, their bowel movements will be changing throughout the next few days. So we had the meconium, like that dark, sticky, tarry stuff. And then that's going to eventually, it's going to change from a yellow-green to a mustard yellow, and eventually will soften in consistency. So just watch out for that. It is completely normal. But it is also important to know that your baby should have their first bowel movement within the first 24 hours. So make sure that's how things are going. We also want to keep check of all feedings, bowel movements, and wet diapers, just to assess that everything is going accordingly. Talking about genitalia, if you have a little baby girl, you're going to wipe, well, let's talk about for everyone. All babies, you want to wipe them from front to back. This is very important. If you do have a baby girl, you're going to expect her to have some white or pinkish discharge. This is just from the extra estrogen that the mother has, and that was kind of passed down into the baby. And when you are cleansing a baby woman, a baby girl, you're going to make sure that you get all of her creases and folds down there, and make sure that the lips and everything's all clean. For the uncircumcised male, again, front to back, and be sure that you clean all folds and creases, and maybe make sure that they're completely dry. Yes, that's very important, completely dry. That helps prevent diaper rash, and if you need to, you can put some little diaper cream on. A male that is circumcised, well, they're going to be going through a little bit of recovery themselves. Again, you're going to be cleaning front to back, and you want to clean them, make sure all the creases are clean, pat them dry, put a diaper on, but you're also going to have Vaseline gauze applied to the circumcision with every diaper change for the first 24 hours. Now, it's normal for you, it's normal for the baby to have a yellow sticky film on the head of the penis. But it is not normal if you notice anything that's bright red or bleeding green discharge. So you should contact your healthcare provider, definitely. Now, another circumcision technique is the plastic ring method, and they do not require the gauze Vaseline dressing. And the ring will usually come off by 2 weeks. And in terms of this circumcision method, if you notice any swelling, bright red bleeding, or green discharge, like I said, kind of with the previous circumcision, you need to contact your healthcare provider. And to clean that area, you're going to wipe gently with a soft cloth, cotton swab, or gauze pad with just plain water. As I mentioned a while back, I think about sleeping, we're going to dress your baby as you would yourself. We don't want them to be too hot if you bundle them up so much, especially if we're in Florida. Come on, y'all. And we also want to make sure that your child's vaccines are all up to date. So be sure to check out that vaccine pamphlet on the way out, and we'll make sure that you're scheduled with we'll coordinate your care with your pediatrician. All right, if you have any questions, feel free to reach out. If not, congratulations, and I hope you guys have a great welcome home with your baby. Bye.